Hi everybody, this is Ben Sturbill with Dr. J at Hartley Chiropractic and Scoliosis Center. So today for our second podcast, I'd like to talk a little bit about adolescent idiopathic scoliosis. So Dr. J, what is adolescent idiopathic scoliosis?
So adolescent idiopathic scoliosis, adolescent talks about the time frame. So adolescent, we're talking about 9 to 14-year-old children. Idiopathic means we don't know what the cause of the scoliosis was. Scoliosis is a 10-degree or more tilt of the vertebra.
Okay. So how would somebody go about treating adolescent idiopathic scoliosis?
Well, we handle it proactively, so a little bit different. So in the medical community, if they have a small curve, 0 to 24 degrees, they just do watch and wait, meaning there is no treatment for a small curve. 25 to 40 degrees, they utilize bracing, and 40 degrees or higher, they recommend surgery. We have an alternative to that. It's an exercise-based correction program, and we call it mix, fix, set. Mix is a warming up of the spine. Fix is a specific adjustment, and set or corrective exercise and traction to get the spine to get into a better position to reduce the curve.
Are these exercises very specifically applied to each individual case? Is it something that you have to, scan and examine in advance with x-rays and tests?
So every patient's exercises are going to look different, and they are very specifically based on their x-ray and their posture.
So in treatment of AIS, what are the recommended treatments in terms of exercises and stretching, bracing? Is bracing for everybody, or who would need braces for their scoliosis?
Okay. So if you do have scoliosis and we find that it reduces with exercise, we do recommend it for most of our patients. So it's a proactive way to reduce and stabilize the curve. Our goal is to avoid surgery and to avoid the curve getting worse during the progressive scoliosis phase, where if you truly have a progressive scoliosis, it can accelerate as much as 10 degrees a month during puberty. As far as the bracing is concerned, bracing is used more so in larger curves than smaller curves, but there are people with 20, 25 degree curves now that we are starting to use bracing with, because we're using a new type of brace called Scolibrace. It's a 3-dimensional brace where we do a structural scan of the person. It creates a hologram. We send that information with their posture pictures and x-rays to Australia, and it makes a 3D brace. And there is some new research that shows that if you get a good in-brace correction on an x-ray and you wear it at the time that you're supposed to wear it, that it does help to reduce scoliosis. So we are incorporating that with some of our patients, more so the more complicated, larger curves.
So I want to talk a little bit about the development of AIS. Is the scoliosis something that starts already at a very young age, or is it something that just appears during adolescence, and what are the causes of it?
So most people, it's just going to appear. So around the age of 9, 10, 11, when 12, when puberty starts in girls, boys can be a little bit later, 12 to 14, the curve can just appear. So even in my own family, 2 of my daughters have scoliosis, and when one of them was just at the beach one day when she was 12 years old, a friend just said, "Hey, did you see the way her posture is?" And she'd been under chiropractic care her whole life. So just like many parents, at first you're like, "Hey, did I miss something?" But then the more you learn about scoliosis, that it develops in puberty. So somebody can go in for a visit to the pediatrician and their child's 10 years old and they don't see any curve, or they may see a very small curve that the pediatrician doesn't think is important. Then they come back the next year and the pediatrician says, "You know what, I think I see something. Let's take an x-ray," and then let's say it's a 15-degree curve. Then they come back when they're 12 years old and they've got a 30 or 40-degree curve. So it can develop very quickly, and it doesn't mean that anybody missed anything. If you're predisposed to have that progressive scoliosis, it's going to happen. The early intervention helps to reduce the curve early, strengthen it in the correct position, and reduce the risk of a small curve becoming a larger curve.
Okay, and are there any risk factors for increasing AIS?
So there's three theories of scoliosis. One is upper cervical instability. So there's a much higher incidence of upper cervical instability in people with scoliosis. So upper cervical instability, a couple things that we'd be seeing on an x-ray. One, your very upper neck, the top bone of the neck would be slid to the side, more than 1.7 millimeters. That's called the ADI, or atlantodental interspace. That tends to be more off in a scoliosis patient. If we see that, we will also do what's called the alar view, which is an open mouth tipping view, and then we'll see that bone even slide even more out of alignment. So that tells us there's a ligament damage up here, and that's where your postural control centers are. There's a much higher incidence of that type of ligament damage in scoliosis patients. It can happen in birth trauma, fall on the head as a kid, sports injuries. And at the University of Washington, St. Louis, where they have a state-of-the-art scoliosis treatment and adult deformity scoliosis treatment center, they're doing research right now on occiput, C1, C2, instability, and scoliosis. So it's not just an idea within chiropractic, it's an idea that's known in the medical community. So that's upper cervical instability. Then we have hormones that we've already talked about. When you go into puberty, your hormones change in your body. So you have all these growth factors that affect the disc in the bone. If you have a small curve, when those hormones kick in, those small curves tend to become larger curves. So if we can stabilize that curve during that process, or even have them in a scoliosis brace, then you can actually use those hormones to your advantage rather than something that's going to make the curve worse. And then we have family history. Although there's never been a proven genetic link for progressive scoliosis, we see it in families. So I did an internship in California. We had 5 generations of a family in our office. They all had the exact same scoliosis, exact same pattern. So I knew that there was something there. My mother has scoliosis, 2 of my daughters. My sons had it. We were able to resolve it in them. I have scoliosis. So there definitely tends to be a family history. But there's not like a proven genetic link where if we see the gene in the kid, we know they're going to have progressive scoliosis. It hasn't got that specific. At different points, they thought they'd isolated it, but now they're thinking it's some type of male recessive gene that's harder to diagnose, but it definitely runs in families. So those are the 3 risk factors.
Okay.
And then also, we know certain activities are a risk factor.
Mm-hmm.
Rhythmic gymnastics, ballet, competitive swimming, volleyball. We know that if you already have the tendency for scoliosis, those things will tend to make the scoliosis worse.
So I wanted to ask, in terms of treatment, is traditional chiropractic care recommended for scoliosis treatment, or should somebody seek out a more specific treatment approach like the one that you practice here?
So if you have a scoliosis, we co-treat many patients with chiropractors. Obviously, if it's a smaller curve, then the curve can be more based toward a traditional chiropractic, and we can be just monitoring the curve and maybe giving the patient more specific exercises. So we co-treat many patients with that. If the curve is progressing, then I would recommend looking at some different avenues, because as that curve progresses, it's going to be harder and harder to get back to that point to where the progression started. So if your curve's gone from a 10-degree curve to a 20-degree to a 30-degree curve, you really need to look at some different avenues. What are my medical options? What are my clear scoliosis options? What are the bracing options? Because obviously this curve is getting worse, and the quicker it's stabilized, the less risk of surgery that you're going to have. So we also co-treat with other chiropractors, pediatricians that have progressive scoliosis, but the patients are going to be doing a lot more in our office than in their office when it gets to that point. Once the curve stabilizes, then we'll refer them back, and they'll keep up with our exercises, but they'll also see their traditional chiropractor.
Okay. So thank you very much, everybody, for watching. That was our second podcast with Dr. J. Hartley. Please subscribe to Hartley Chiropractic and Scoliosis Center on YouTube, and we'll see you soon.